Hello, and thank you for taking the time to learn about the BioVigil hand hygiene solution. BioVigil is a hand hygiene reminder and awareness system that will prompt you to do hand hygiene when necessary throughout the course of providing care to patients. Thank you again for taking the time to learn about this, as we know you are working very diligently to keep your patients healthy and safe. The BioVigil system consists of a number of components, including beacons that are placed above patient doorway thresholds. These beacons, in concert with the badge that you see in the lower right-hand corner, will determine when a staff member wearing a badge enters or exits a patient zone and whether or not it is necessary to perform hand hygiene in that situation. The badge, again in the lower left-hand corner, or one that I'm wearing right here, illuminates green to indicate that you have clean hands and are within the hospital's hand hygiene compliance policy. It lets patients, their family members, and visitors to the hospital, as well as your coworkers, know that you are within compliance in performing proper patient safety in regarding hand hygiene. The badge will also illuminate other colors to indicate when certain hand hygiene activity is necessary. The departments and nursing units throughout the hospital have been provided with base stations, which is where the badges sit when they are not being used. The badges charge their batteries on the base station. They also receive software downloads and uploads, and data downloads and uploads. Badges that are green are fully charged and ready to use. Badges that are red are either undergoing maintenance or receiving a software update, or they're still in the action of charging. A fully charged badge should last 12 to 16 hours or throughout your entire shift. When you are getting ready to perform patient care, you will need to check out a badge. To do so, you will take your hospital ID card or the issued BioVigil access card and hold it up to the indicated spot on the base station where it says touch card here. Hold your card up, you'll hear the base station beep, and one of the badges will illuminate white. That is the badge that has been selected for you. It's a badge that is fully charged, so again, it should last an entire shift, 12 to 16 hours. When you pick that white badge up from the base station, it will beep and turn green, indicating it is ready for you to use. We ask that when you do scan your hospital ID badge or the access card to the base station for the first time, you do want to check that display in the upper left corner of the base station to ensure that your card is registered. If it is not registered, a message will display indicating the actions you need to take to register it. Once you have your badge, you'll want to attach it to your person high up on the shoulder. We suggest that you pinch the seam of your scrubs and simply attach the badge there. You want the badge to be facing outward. It does not matter if you wear your badge on your right or left side, that is your preference, but you, again, make sure that the green hand is facing outward. You don't want the badge to be covered up by a jacket, stethoscope, or other equipment that might be hanging from your person. Once you have your badge on, our intent is to not change your workflow. However, one new thing will occur, which is you will record all of your hand hygiene events on the badge. If you are using sanitizer, any sanitizer that is at least 60% alcohol will work with the system. But if you are using sanitizer, obtain some hand sanitizer from the dispenser on the wall or other locations where it may be located in the hospital, such as from a pump. Apply it to your hands as you normally would, and do a thorough hand cleansing as you normally would. You then, when it's about 75% of the way rubbed in, take a cupped hand, hold it up to the badge. You'll hear a positive tone, and that registers your hand hygiene event. If it is green, the badge will stay green. If it's any other color, it should turn green. Again, take some sanitizer from the appropriate dispenser, rub it in enough that it's not going to get all over your clothes and get your scrubs all wet, but so there's still some residue on your hand. Hold that cupped hand up to the badge, hear the positive tone, and know that you're ready to engage with your patient. It is necessary to use that cupped hand because there's breathalyzer technology inside of the badge, and it's detecting the alcohol on your hand. That closed cupped hand concentrates those alcohol fumes so that they can be detected on the badge. There is also a light detector on the badge, so that closed cupped hand provides the shadow necessary to indicate that you are bringing your hand to the badge for a hand hygiene event. If you just flash your hand at the badge or wave your hand at the badge or even grab the badge, it will not effectively capture that hand hygiene event. You want to use that closed cupped hand. Should it be necessary to wash your hands at the sink, or if you prefer to wash your hands at the sink, there is a slightly different technique that is used. You will just walk up to the sink and wash your hands like you normally would with soap and water. There is now a beacon placed near the sink that is communicating with the badge as you are standing there washing your hands. After 20 seconds, the badge will turn blue, indicating that you've been there long enough to fulfill the sink wash requirement. Finish washing your hands, then take a wet or dry hand, hold it to the badge. Again, you will hear that positive tone and the badge will turn green again. I'll demonstrate that one more time. Just simply walk up to the sink. You don't need to take any actions, but simply walk up to the sink and start washing your hands. After 20 seconds or whatever the hospital time requirement is for a sink wash, the badge will turn blue. When that happens, continue washing your hands until you're done, then hold your hand up to the badge to register that sink wash. In that case, you are being timed at the sink, and then you are holding your hand up to confirm it. It's detecting the shadow of your hand. It doesn't detect soap or water, but simply the shadow of your hand. And you are acknowledging with that holding of the hand that you have completed a sink wash. If you are standing at the sink doing an action such as charting, having a conversation, crushing meds, maybe even cleaning the sink area, the badge might detect your presence there and may turn blue even if you aren't washing your hands. If that's the case, as you walk away from the sink and break the connection with that beacon, it will go back to the color it previously was. However, if you were washing your hands, you need to hold your hand to the badge in order to receive credit or register that sink wash. The badge reminders. If you do hand hygiene typically within 60 seconds or whatever your hospital's protocol is, prior to entering a patient's room, the badge will stay green. Same with exiting. If you do hand hygiene within 60 seconds prior to exiting the patient room, the badge will stay green because you've already performed your hand hygiene and it is not necessary to be reminded. If you enter the patient room and you hadn't done hand hygiene yet, the reminders would start. Also, if you exit the patient room and you hadn't performed hand hygiene yet, the badge reminder would start. With the reminder, the badge turns yellow and it beeps and vibrates at predetermined intervals for typically up to 60 seconds to provide you that 60-second window in order to do hand hygiene upon the room entry or exit. If your hands are full when you enter the patient room and you aren't able to perform hand hygiene immediately because your hands are full, that 60-second reminder interval will give you time to put the materials down or put the supplies down, go to a sink or go to the sanitizer, perform hand hygiene, and return the badge back to its green state. If you do not perform hand hygiene within that allowed time period, again, typically 60 seconds, the badge will turn red. Red is what you are trying to avoid, as it indicates that you are not in compliance with the hospital's hand hygiene policy. Yellow is simply a reminder and is just sort of like a caution light, similar to on a traffic light. But red means stop and perform hand hygiene as soon as possible. If you have a red badge, perform hand hygiene at the sink or with sanitizer to return it back to green. There are a number of workflow allowances built into the badge that I'll be discussing momentarily, but a few other things about the hand hygiene reminders. As I mentioned previously, if you do hand hygiene within 60 seconds before you enter or 60 seconds before you exit, you do not receive a reminder. In the event of potential cross-contamination, which is when you leave one room and enter another room and do not perform hand hygiene in between, the badge reminder will become more urgent. The reminder will be shorter, it will beep more frequently because it is a particularly vulnerable moment for the patient. Should you require to be in a cross-contamination situation, you need to do hand hygiene as soon as possible in an effort to keep that patient safe before you come into contact with them. If you are if you are exiting a room that is set in contact plus precautions, for example, if the patient has C. diff, as you know, it is necessary to do a sink wash when exiting that room in order to wash the spores from the C. diff off your hands. Provided that a staff member, typically a charge nurse or a manager, or maybe somebody from your infection prevention team, has set the room in the appropriate settings, a sink wash will be required upon exit. The badge will not accept a sanitizer event when you are coming out of a room where the patient has contact plus and the room is put into that setting. Sink washes are necessary. Follow your hospital's hand hygiene policy, but typically that sink wash can be performed either in the patient room or out of the patient room, provided it is conducted within the required time interval. Sanitizer will not be accepted on the badge. The badge will flash blue several times as a prompt to go to the sink when exiting a contact plus room if you try to use sanitizer. So to go over that again, if you do hand hygiene within 60 seconds before or entering a patient room, there is no reminder. If you leave one room, go into another room, and do not perform hand hygiene in between, the badge reminder becomes more urgent. If you leave a room that is in the contact plus setting, typically indicated by signage on the door, the badge will not accept a sanitizer event. You need to use soap and water and wash your hands at the sink in that case. As I mentioned, there are a number of workflow allowances built into the badge to make it fit within your normal workflow. The first is a check-in or a re-entry allowance. So if you are doing something like a bed check, checking in to make sure your patient is resting peacefully as you would expect, you can step into that room, and if you had not done hand hygiene, the reminder would start. However, if you leave the room within 60 seconds, the badge reminder will cancel. This can also come in handy if you're just doing something brief, like quickly looking at an IV pump, or checking a monitor, or even just asking your patient a quick question, such as what their pain level is. Always follow your hospital's hand hygiene policy in this case, but the badge does allow you to step into the room briefly, have the reminder start, and then leave within 60 seconds, and the reminder will cancel. This is the same if you are in the room and you need to step out in the hall, such as to ask a fellow staff member for assistance. The reminder would start had you not done hand hygiene prior to exiting. However, if you return to the room within 60 seconds, the reminder will cancel. There is also an allowance built into the badge for rounding, such as when you're going from room to room to room to check on patients. If you leave one room and perform hand hygiene and then promptly go into that next room within 60 seconds, the badge is not going to remind you to do hand hygiene twice. It credits you for doing hand hygiene with the one room exit, and then if you go quickly into the next patient room, it credits you for doing hand hygiene on your way into that room as well. If you go to the soiled utility room, often known as dirty linen room or the biohazard room, and the reminder is going off, the reminder will cancel when you enter the soiled utility room. This is because that is a dirty space and it doesn't make sense for you to wash your hands upon entry to that room. When you leave the soiled utility room, the badge reminder will go off. But if you are going to the soiled utility room and you are carrying soiled materials or wearing gloves and the reminder is going off, it will cancel when you enter that room, so you don't need to deglove and perform hand hygiene simply to satisfy the badge. It will cancel when you enter soiled utility. If you are donning isolation gear, the proper protocol would be to perform hand hygiene, register it on the badge, then don your gown and gloves and enter the room. Lastly, you can exempt yourself from doing hand hygiene in certain situations where hand hygiene is not practical or possible. We often call this the snooze or the pause feature. If you squeeze the badge or press and hold on the front of it, it makes a noise similar to like it's shutting down and will start to fade in and out green. You do have to deliberately squeeze it for about a half a second for this mode to go into effect. Then this will exempt you from doing hand hygiene for one room. The first room that you go into is what the badge will commit itself to. And then you can go in and out of that room as many times as necessary without a reminder. There's no time limit on this. It will allow you again to enter or exit that patient room as many times as necessary without performing hand hygiene. Use your discretion for using this feature. It was designed for emergencies or codes, but can also be useful when you're ambulating a patient, transporting a patient, or even going in and out of empty rooms. The badge will stay in the pause mode or the fading green mode until you perform hand hygiene. If you enter a new room and had not yet performed hand hygiene, the badge would activate on its own, recognizing that you're in a new space and that hand hygiene is necessary. When you are done using the badge for the day, you should clean the badge appropriately with a sandy wipe, alcohol wipe, or other approved wipe for cleaning the badge or for cleaning hospital equipment. Try to avoid the bottom part of the badge where there are connectors, and you can also open the front of the badge to clean the inside of the badge. Allow it to dry for a few minutes or seconds, and then place it back on the base station. When you place the badge back on the base station, you will hear it beep, and it will most likely turn red because it has started charging. If you need to take your badge off at any point during the workday, we recommend that you put it back on the base station. If the badge is lying flat, it will shut itself down after a period of time. So if you take the badge off, we ask that you clean it and return it to the base station. And people always ask, what happens if I take the badge home? Return it next time you work. That concludes this overview of the BioVigil Hand Hygiene Awareness System. We hope that this helps you in providing patient care and keeping your patients safe and healthy. We ask that you also keep yourself safe and healthy, and we thank you for all you're doing to keep everyone in good care in your clean hands. Thank you.